Good afternoon, everyone. The topic of my presentation is exploring comprehensive biomarker testing in non-small cell lung cancers by next-generation sequencing, a single-center experience. Non-small cell lung cancers are very frequently detected malignancies with a very poor prognosis and high mortality. There are diagnostic, prognostic, and therapeutic biomarkers which help in the clinical management of these patients. However, unfortunately, only a few of the FDA-approved biomarkers like EGFR mutation and alkyne ROS1 rearrangements are routinely tested in our country. However, multiple studies have shown other recognized oncogenic alterations which can become potential biomarkers for the future. So a single assay which can comprehensively and rapidly detect majority of these mutations is of great value in our country, especially in places where lung cancer is one of the major causes of mortality and morbidity. The aim of my study was to document the utility of NGS-based DNA and RNA sequencing in non-small cell lung cancer patients. This study was conducted between July and December 2022. The routine assessment of these patients involved histopathological and immunohistochemical based subtyping of the tissue, after which molecular mutation analysis was processed for DNA and RNA variant analysis utilizing the targeted NGS panel ion torrent oncomine focus assay from Thermo Fisher Scientific. This is a well-annotated panel with 52 genes capable of detecting hotspot SNVs, indels, copy number variations, and gene fusions. Once a test is raised, the FFP tissues are interrogated for the tumor cellularity. A block is selected which is having at least 30% cellularity and is taken up for DNA and RNA extraction, followed by routine NGS sampling and sequencing in the Gene Studio S5 system. The reads generated were aligned in the Ion Torrent Suite software and variants were annotated as per the Ion Reporter. A total of 91 cases were studied between this 6-month period. The age of the patients ranged between 23 and 83 years with a mean of 64 years. A male predominance was noted in our study cohort. This chart shows the smoking status of the study group, and a near equal proportion of smokers and non-smokers were present in our cohort. Of the 91 cases for which oncomine focus assay was performed, majority were adenocarcinomas, followed by few non-small cell lung carcinoma, NOS, squamous cell carcinoma, and poorly differentiated carcinomas. On analyzing the gene mutation profile, majority of the mutations were in the adenocarcinoma group, followed by the NSCL LC-NOS. No mutation in the squamous cell carcinoma and poorly differentiated carcinomas were noted utilizing this panel. At least one variant was detected in 75% of the cases. 65% had only DNA mutations, 8% had RNA fusions, two cases had both DNA and RNA variants, and 25% were wild type. The DNA mutation spectrum showed majority of the mutations in the EGFR gene, followed by KRAS, beta-catenin gene, BRAF, and PIK3CA. A total of 9 genes were mutated, and the total number of mutations was 76. 12 cases showed mutations in multiple genes, and the mean mutation range was 1.2%. The distribution of the EGFR mutations showed a predominance of the activating L858R mutations and the exon 19 deletions. 2 cases of compound mutation were detected harboring the resistance T790M mutations. The second most common gene mutated in our cohort was the KRAS mutations, which was clustered in the hotspot codon 12 and codon 13. Interestingly, we got 3 cases of G12C, for which sotorasib targeted therapy is now available. 9 cases were positive for RNA fusions. An equal 4 number of cases were positive for EML4 ALK fusions and the MET exon 14 skipping mutation. A solitary case of ROS1 fusion was also detected. An added advantage of the NGS panel is not only do we get to know the fusion partner, but also the exons in which breakpoint occurs. This is of increasing importance in EML4 ALK, where further subdivision of the variants can be made according to where the EML4 breaks. And we got 3 cases of the commonly detected variant 1, which is having a better prognosis and better response to targeted therapy, while we had a solitary case of EML4 ALK variant 3, which tends to have a much aggressive course and poor response to targeted therapy. Interestingly, this patient received targeted therapy but progressed within 3 months. EGFR mutations Beta-catenin mutations and ALK fusions were more commonly present among patients who had a history of smoking, while MAP2K1, who are non-smokers, and MAP2K1 and KRAS mutations were more prevalent among patients who had a history of smoking. We also classified the impact of these variants according to the tiers of clinical actionability and found that 64% were tier 1 biomarkers having strong diagnostic and prognostic impact or an FDA-approved targeted therapy. 2 cases of tier 1 resistance mutation T790M in the EGFR gene was also detected, for whom osimertinib was offered. Other rare resistant mutations like KRAS G12D and ALK G1202R were also detected utilizing this panel. A mean turnaround time of 10 days was noted, and the cost was nearly 1.2 times less and with more genetic information as compared to other non-NGS-based single gene testing. We compared our data with those of other published data and found concordant results. The mutation frequency was 75%, which was in concordance with a similar study from our center 2 years back using a different targeted DNA panel. The EGFR mutation rate and other DNA mutations were also concordant with other national and international studies. The RNA profiling also showed concordant results with other domestic and international studies. To conclude, next generation based targeted panels can provide a very comprehensive and high throughput detection of all the biomarkers in non-small cell lung cancers. We detected mutations in 75% of our non-small cell lung cancer cases, with EGFR being the most common mutation. Adopting next generation sequencing can not only help to detect established, but also emerging biomarkers faster, economically, and with little tissue utilization. Thank you.